The knee replacement resulted in residual pain right in the side and the front of the knee that wouldn't go away, and I couldn't walk on it without a serious limp.
I had pain right in that part of the knee along the side near the top, and mainly on the side. And it was severe enough that it was difficult standing on it.
It was pretty debilitating. I'm a lifelong golfer and I couldn't play golf anymore. Well, they didn't know exactly. They felt that the knee was impacted by scar tissue and there wasn't an awful lot they could do about it from an orthopedic point of view.
A lot of orthopedic surgery is done very close to peripheral nerves, and orthopedic trauma and even orthopedic surgery, things like joint replacements, are a little bit sort of rough by their nature. I mean, if you have to replace a joint or fix a bone, or the trauma that goes into causing some of these orthopedic injuries in the first place can often injure the peripheral nerve at the same time.
Doing much better. I'd say the pain in the knee is probably 90% relieved, and there's a little residual pain left over in another area. But after the surgery, it was a little tender to the touch, and that's gradually disappeared, and right now it's in pretty good shape.